So my name is Janice Reese, and I am the FAST program manager. And I'm going to kind of kick off the beginning of the presentation today. I'm not sure. I think it's actually in slideshow mode. Hold on. Let me stop share and just give you a little bit of an update on where we are with a couple projects as we start the presentation here. So I'm going to talk a little bit about where we are and some of the momentum and progress. I think most of this audience knows who FAST is and where we started and how we are where we are and kind of the momentum of what we're doing. We continue to grow our members. We're excited about a few new members. We have Well that is planning on joining and helping us with the co-lead of our FAST identity work, as well as Onyx Health. All right, it's still showing in slideshow. All right, do you see the full screen?
It looks like we're seeing
You had it
several.
right before. You had it right before, I believe.
Yes, yes, this is that now we can see it, Janice. Now we can.
Okay, what I want to talk about is we are about to kick off our FAST Digital Identity STU3 efforts. Our co-leads are going to be meeting on March the 26th. We're going to be tying what we're doing, obviously, to the momentum of what's happening with authentication, authorization, and patient matching across the CMS aligned networks. So, wanted to give a little bit of background on that. We are cultivating a couple of additional health plans that we've been talking to that are also involved in identity that we're hoping will also add their names to FAST and become a part of this additional work, as well as some of the specific credential service providers who are part of the CMS aligned networks and some of the aspects. So our objective is to continue to build on STU2 and to align with the Karen Alliance Digital Trust Framework as additional guidance that they've provided as part of our work. So we will be working closely with the Karen Alliance to do a joint FAST Identity Karen Alliance next version that will get into the technical implementation patterns that are necessary to enable federated digital identity across healthcare networks and continue to work closely with what we're doing on the next version of our security as well. So some of the things that we're working on here is there has been a common data model identified by the identity working group of the various credential service providers. So we are looking at that and how that kind of integrates into the scope. And again, these are all elements of what our co-leads and the industry will start to bring as we scope out the specific technical requirements on STU3, but wanted to bring it to the attention in case there are members in Da Vinci that also want to get involved with our next version of Fast Identity and what we're working on. We are tying it together, as I said, with the Karen Alliance with their policy and trust framework. I have a link in regards to the Karen Alliance with their digital identity credential policy. Ashley Hudick from Levitt Partners, who wrote this, will also become part of our co-leads. And this aspect of their work will be separated out as guidance in STU3. And again, our co-leads will kind of lead that as we go forward, but it will give us some context for being able to integrate things that are happening in the industry. We also are making considerable progress with National Directory. Fred Trotter has been very active in our meetings. We've got more than 20 organizations that were participating in our call on Monday. Very much working on how this becomes the ecosystem for the routing layer, but it also obviously connects into what we're doing with identity because they are looking at how they validate identity as part of directory, how we connect securely with what we're doing with security, and also aspects of things relative to consent when we get into other things that are happening relative to directory. So we think all of these are important to continue to keep educating our partners in industry on of not only our individual projects and the momentum of where we are and what we're developing with STU3 with both security and identity, but also the momentum of where we are with National Directory with STU2 and the ability to hopefully publish that later this year, in essence, to helping Fred meet some of the goals he has around the CMS provider directory. Consent is moving forward rapidly. We are targeting our publication in May of 2026. We are finalizing our implementation guide. We're also looking at how does this need to integrate with various aspects of testing at scale, because we are looking at the multiple ways that we need to test some of the different IGs, and that includes identity, security, and consent. We also are looking at more both CMS use cases as well as Medicaid pilots, and working in collaboration with a specific use case with the National Council of Prescription Drugs on specialty pharmacy and a multi kind of actor consent requirement when you have a prescription for a medical device. So definitely a lot of momentum at HIMSS. We did a consent presentation at the HL7 booth and had a lot of good interest on the topic of consent. We're really looking at our FAST trust track, and we had an excellent testing at scale meeting this morning, continuing to talk about the details of how we think about multi-actor testing and other aspects. And that's obviously one of the areas we see to further develop with this audience and the background. But being able to think about, where to send data, who's participating, how trust is established, what's permitted, and then things that are looking to be tested, especially across the CMS aligned networks in reference to testing in some of those areas. So we did do a lot of discussions around how fast is the infrastructure at HIMSS, and this diagram is really something that helps articulate that both in the partnerships that we work with across Sequoia, the RCE, Direct Trust, and others, and then the momentum of what's happening with the CMS aligned networks. And this was the backdrop for our presentation, our kiosk. We had it designed, we had people stop by and take photos. This is really the vision our co-chair Jason Teeple put together to develop to help draw out what we're fast as a part of what the vision is of the CMS aligned networks. And I know we've spoken about this diagram in previous discussions with Da Vinci and Trebuchet, so I won't get into much more detail, but it is areas that we're continuing to give visibility for where FAST has been doing the work. We've got our implementation guides that have already been published, and we're continuing to evolve that with other aspects. And with that, I think I will turn it over, and the next part of the presentation will go back to Dave.
Okay, Janice, I need you to keep running the slides because I'm not at my desk at the moment.
All right.
If you can bring the slides we put together back up. Okay. Is that the? Okay. Should be one starting with. There we go.
Got to start back at the beginning for some reason since I reshared.
That's fine. Yeah. So, there we go. So just wanted to say thank you everyone for inviting us back. I did talk about this in January, apparently. Time is flying by with traveling. This is talking about HRex and security. As pretty much everybody should know, HRex being the basis for everything, has a very small security section, one of which formats. Up until last year, that just said a fast security IG to be named, to say the fast security guide in its full glorious name, which I won't say, but it's on the top of the screen if you need it. And this is, of course, based around the trust community and trust frameworks. You're seeing it being used more in TEFCA. You're seeing it used in care quality, Commonwealth. All of these have set up a basis and really trying to get it into the testing community to make it more available and get people on board. So as it rolls out, not only within the United States, but around the world, become more, more understood and more implemented. Basis for it, of course, X509 certificates, and of course OAuth and OIDC, depending on which aspects of it you are looking at. Can I get the next slide, Janice? Okay, so for those of you who are living in the rock and haven't seen any of my previous presentations, here are the basic parts of it. So the whole thing is basically Java Web Token-based authorization assertions. So authorization and authentication, both using JOT, just to make it possible to simplify it and to allow for the use of certificates as part of the workflow. The biggest part is server metadata. I'm going to jump all over the page because I keep wanting to reorganize this page and never get around to it. Is the server metadata. When you first touch the server, it has a .well-known UDAP endpoint that has all the metadata to really make it understandable what needs to happen from this point. So what the authorization endpoints are, what the signing requirements are, that kind of thing. Because we want to make sure that it's as interoperable as possible without any kind of human interaction. So dynamic client registration, as we say, trusted dynamic client registration, that's based on the two aspects. That is the certificate itself that's been issued by a trusted third party that highlights the trust community and how that trust community is organized. And that means that they've signed all the policies, they've agreed to play nice in the sandbox, and everything goes there. Attached to that are two things. One is a software statement, and that is the basic declaration of what this software is, who it is, putting it forward, what are the base scopes that will be used, and those scopes tend to align with the Smart on FHIR scopes, as well as additional information around the organization and all kinds of things that can be included with it. This is portable information. So it is done once, used every time in the community. So if there are 200 members or 200,000 members, they each see that same software statement. That simplifies it and speeds everything up because that information with the certificate is the basis for saying, yes, we will accept you because we know that you are a trusted part of our community. Added to that can be certifications and endorsements. And we're really getting into that. And for those of you who didn't stop by the presentation at the HL7 kiosk at HIMSS last week, we're looking at a wide number of things, and that can be set up again by the trust community, but it could also be something like the LEIs. And if you want more detail on that, I'm sure Mark Scrimshire would love to sit down with you and explain it. But those are the three aspects of it that make it so that an organization participating in this trust community can issue a client ID out to the members. And that means that if you are participating in a large trust community like TEFCA or building your own, so we have a number of organizations who are using fast security to build smaller trust communities of their own around development portals, around any aspect of their business, so that they have defined controls that using certifications has. So on top of that, of course, once you have the client ID, you can go through, and it's fairly straightforward OAuth, right? Authorization flow, authentication flow, both the same. We add on top of that right now the tiered OAuth that allows for the injection of a CSP into the authentication flow, saying that, yes, that CSP guarantees it because that person would log into the CSP's website as part of the flow. Okay, next slide. All right, so really the benefits that we're talking about and the reason we want to make this part of the basic security flow in HRex, and of course that means CDEX, PDEX, and everywhere else, is because it makes for easy scalability. The app onboarding, lifecycle management, automated discovery, all of this makes it so that you can do this at scales that Smart on FHIR unfortunately can't handle because of the manual aspect of it. And of course, because you're using trusted apps, trusted servers, identified with certificates, that means that compromisation, there we go, there's a word, is minimized because all the information is vetted all the way through the process. App impersonation, server impersonation, just absolutely tightened up, which means that you have real data provenance and you have credential trust for all those things. That means ultimately that you're exchanging data between trusted endpoints. You can trust it not only for read, but potentially for write into the system, because all that information and the backing of the trust community is in place to do that. You add that to verifiable directory information, an endpoint identity, a digital identity, and suddenly you've got a very powerful source of trust for your organization. All right, next slide. Okay, we're going to go through the various parts of it just quickly. I don't want to bore everybody to tears. I've already told you all the good bits. Again, the FHIR server, as part of endpoint discovery, says the authorization servers, the authorization endpoint, the token endpoint, the registration endpoints, all the metadata necessary to make a registration is available at the well-known UDAP. That means no client has to ever talk to a person. There's no emails, there's no phone calls unless something goes wrong. And if you set it up well, nothing ever goes wrong. And that's my line, and I'm sticking to it. Next slide. Yeah, let's just skip. All right, dynamic client registration. Again, this is the biggest thing. This is an RFC standard that we've profiled. You can see the same standard in Smart version 2.2. They have brought in client registration, but we've actually taken it to the step necessary and tested this in real world scenarios to show that this works. So for larger ecosystems, again, 200, 2,000, 100,000 requesters, responders, the digital certificates hold sway. So everybody that goes in, they sign the appropriate agreements, they agree to follow the exchange principles, the technical requirements, gets a digital certificate, and that means that you take that with the various information that I talked about earlier and get a client ID. So it extends the OAuth2 workflows, gets everything going, and gets it running. So, and I keep harping on this, but this replaces all the manual processes that we deal with every day with trying to get a new app on board. By going through Smart on FHIR, it's great. I'm a big fan of Smart on FHIR, but it is one at a time, and it is a partial manual process. When you're scaling it out, that becomes a problem. By having the reusable credentials and the certificate and the certifications and endorsements right through the registration process, everybody can do this automated because they know what to expect. They have the answers they need based on the trust community's requirements, and everything flows quickly past that registration point. Next slide. Again, talked about certifications, endorsements. It can be any additional information. Again, the LEIs, the VLEIs can be added to that. In TEFCA, we add the home community ID as part of that, just to tie things together so that not only do you have certificates saying, hey, this has been issued to this organization as part of this trust community, but it's also tying it to this server or this location, this something. Or, hey, we're also asserting this information as part of registration, which is outside the software statement and certificate flows. And of course, there can be more than one. You can have an auth server to have require none, one, or as many as necessary as part of that trust community setup. Next slide. Okay, the JOT-based client authentication. This is another big step, because right now you have shared secrets as part of the Smart flow. And again, that's a very powerful statement. Those shared secrets are tied to the organization. They're very good, but we use public key infrastructure. We're using RSA, elliptic curve, those kind of things to make it more scalable so that you don't have to worry about if a shared secret gets somehow shared beyond where it's supposed to go, that's easily locked down through taking the certificate away to, invalidating the signatures. So that means that you have that confidence beyond read-only access. Again, more extensions at this point as well. We have defined the HL7 B2B extension as part of this. Additional extensions can be created. I know in TEFCA, they have their individual access services extension, as many as necessary to get that community set the way it needs to go. So if you're building your own community, if you're setting up a developer portal and want to create a trust community around that, you can have them say, hey, these are the kinds of things you're going to use the data for, or these are the kinds of access we need, or these are the kinds of repositories we're working with. And of course, because it's OAuth, we work with client credentials and auth code grants. And of course, with our tiered OAuth, we can, as I said, we can inject the CSPs into this. Next slide. Okay, basic workflow. I don't know if I'm going to go through this. I don't want to bore everybody to tears with this diagram, but it does show that the basic part, that trust community certificate authority is out of band. Those certificates have to be done in advance, but that's done once to issue cert for each member of the organization. Once they have taken that, they go to the trusted dynamic registration request, sign with that client's private key as part of that 509 cert. Once they've gone that, validate it, returns client ID, follow standard OAuth using JOTS, and get their access token, and away we go. That means that, again, it's following flows that we're all familiar with. Not much more to be said about this diagram, so I'm going to skip it. Next. Okay. The biggest thing is people have asked me a number of times, is this a lot of work? And the answer is no, because chances are if you're writing anything that touches the web or FHIR, you're already doing OAuth. We're adding the PKS, X509 library to that, standard OAuth and OIDC to it. And we've had people say they've gotten code ready in production as little as 8 weeks. Of course, I mean, when you're doing this, you want to talk about client, server, or both. So you want to start with registration. So that's going to be the biggest change, because you're going to be dealing with the PKI, you're going to be dealing with the input of the software statement, any certifications, endorsements, and being able to parse those through as part of the registration. That means if you are going with an auth server that's going to do this innately, and you're not buying one of the ones that now support it off the shelf, that's going to be your biggest coding aspect to it. Once you have that client credentials flow, auth code flow, those are very simple. That's straight OAuth. It's using a JOC, same as is in the spec, but slight modifications. If you're going to do tiered OAuth because you want to do that extra layer of patient involvement, or even user involvement by having a CSP in there, you'll do that last, because that is a simple injection into the authentication flows. Simply doing the out call to the patient, and usually this would be supplied as part of the extension, saying, hey, this is the patient ID token signed by the CSP. I know that, again, in many of the national networks here in the US, they are injecting that token right into the extension. You can take that one step further and say, hey, I've got a token, it's signed by this group. I will go to their validation endpoint and have that person log in or validate themselves through whichever demographics they need to. Next slide. All right. Here's where it gets plugged in. So at HRex, that's where we've been talking about. Again, we're looking at, and I've been talking with the architects of PDEX, I'm talking with Lloyd and such, about expanding the security to better define how these various security standards can be injected, and what use cases best suit them. Again, Smart on FHIR works really well. It's a strong standard. It's been around since 2019. Defines the scopes that are used all over the place in that. And if you have, want to build your network one point at a time, there is nothing better. If you need to build your thing in an automated fashion, you have a larger number that simply one-on-one is not going to work. That's when we recommend fast security. In burden reduction, the DTS and PAS, or CRD, has a slightly different security method. And in PDEX, we're seeing that in the connectathons, of course, fast security has become a bonus track. We recognize that, if we're going to roll this out through national networks, through others, that we need to make sure people have a good understanding and have tested against that. In CDEX, of course, like all the rest, based on HRex, we don't have any specific aspects of it within our IG or interactions with CDEX, but we are trying to do outreach. We're trying to make sure that anybody doing any of these has the ability to work with us and work with our teams. Next. And of course, we're leaving you all alone to do this in the dark. Wait, no. We have a number of tools. The entire UDAP Ed tool set. This has been developed by a number of our toolsmiths who've gone through, created full tool sets in .NET, in Blazor, in all kinds of things on how to get this. We have the UDAP.NET. This is published as a NuGet package in the UDAP star namespace. For those who understand it, it is the Duend identity server. UDAP End also has a whole UI tool written in what's called Blazor. I'm not familiar with Blazor. I keep asking them to explain it to me, but never get a chance to. It operates as a full client, deconstructing UDAP mechanics, showing you the fast security steps right through so that you can get a good feel and can do a full test suite. If you are just learning this UDAP Ed is wonderful workbench. We've given it to a lot of people, and everybody's come back and said that simplifies the process of learning so much. Of course, we have the UDAP SDK tutorial that demonstrates how to use the SDK that's published by udap.org to enable the fast security with your own identity server implementation. It includes an example of the tiered OAuth identity server for those of you who want to go that extra step. And of course, we have all kinds of videos. We have done a number of presentations. We have the UDAP Egg diagnostics tool done that. And of course, the 2023 FHIR security education event, that was all recorded. So there's all kinds of useful information in there. We continue with recording presentations at the various connectathons. We had a demo at the January connectathon by Epic, who has implemented it, and they showed how their implementation works. So we're really happy about the level of adoption as things move into the future. One more, next slide, I think. Other tools, Evernorth, Okta has a reference fast security app. They have client SDK and server that's published under the Evernorth GitHub. And of course, Spring Boot, that's under UDAP tools that was published by udap.org itself, and how to do UDAP using Spring Boot. So whichever system you're working with, chances are somebody has done a reference implementation or a guide on how to work with that. Next slide. Well, that's it. Right. Originally, this had been part of a three-part process, taking advantage of both the Trebuchet and, of course, Lloyd Mackenzie's knowledge of everything HRex. This was just my section of it, so we have expanded a bit, but that's all my slides. I can happily take questions, or we can all go for ice cream.
I'll just comment as well that I can find the link and put in the chat that FAST is also going to be part of the U.S. Connectathon, the U.S. Realm Connectathon coming up March 31st through April 2nd. We'll have a directory track, we'll have a consent track, and we'll have a combined fast security TEFCA track that Dave can speak to if there's questions.
Oh, I gave them all the information they could possibly handle. They don't have any questions.
Thank you, Dave and Janice, both. anyone have any questions for the FAST team while we have them here?
Sure, Dave. What do you see as the main barrier to adoption?
The main barrier for adoption right now is people feeling that it's still new, which is odd since it's been around for 12 years. People have been looking at smarts, and smart is everywhere, and smart app launch has been part of situations for, well, it's published 2019. You started seeing smart apps almost immediately.
And I think that's been the biggest barriers, is people just not thinking it's new and exciting, and people are always prevented from doing that. Now that we're seeing the major HR vendors, we're seeing some of the payers beyond Evernorth, who has been one of our initial sponsors, implementing it, giving us feedback. We're on version 2, which has put a lot of cleanups, mostly in language, made it a little more flexible to handle multiple communities. I'm seeing that kind of go away. But from a technical point of view, it's just a matter of people go, but I know smart, I want to use smart. And that always slows everything down if they have a preference and don't want to slide away from it. Next question.
What are the new attack vectors that you would foresee, like from technology? So if I go and adopt this, am I just more secure? Am I less secure in some ways or more secure in other ways? How do you see this changing security for organizations?
I think the biggest change is it does enhance security because of the centralization. You have the one benefit that is the certificates itself. So the X509 certificate, where everything is signed by the private key, that's adding a layer because that key is controlled. And again, you can always have a private key slip out of control and things will happen. But it is much easier to lock down a certificate, right? Suddenly you find out that cert has either become compromised or has become attributed to a bad actor. If you disavow that certificate right away, it gets added to the CRL, that person loses not only the registration but all access as fast as people check that CRL. And because that is flowed right through, so the certificate becomes part of that whole chain leading to the OAuth. It's much more controlled. It's much more locked down. There will always be new vectors, but because we are using OAuth, that's as bulletproof as the web will ever have. We are using an RFC, which has been vetted, and we're simply adding additional layers to make it that much better. By having that information as part of the software statement, you have information if somebody starts going outside what's expected, right? Because you were told up front, hey, they're only going to use these scopes, or hey, they're only going to access these endpoints. If somebody starts acting outside of that, you know that information right away because it was part of the registration and can be incorporated into a policy server without having to have humans sit down and start typing. Is there more attack vectors? There will always be more attack vectors. That's why we refine it. We are looking at a number of things. We have people asking us if we want to JKUs as part of version 3. That has their own attack vector. So all of these things are looked at. We have some really high-end security experts review this every time we do even a partial update. So 1.1 went through a security review to make sure we're not invalidating the security envelope that's created by the full OAuth flow. Come on, Scott, you got a third question for me? I can feel it.
I want other people to chime in.
All right.
Here's a good question, Dave. is there a reference implementation and or package that could be sort of dropped into, somebody's FHIR implementation for them to be able to start leveraging Sarah/UDAP?
There/UDAP/fast security.
Yeah,
There we go.
all of
Yes.
those.
Yes, of course. One of the things that we do as part of the fast things, we have created and keep up to date our reference implementation. This is a fully open source implementation of this. It's based around all of the open source software out there. It is available through the HL7 Foundry. If you go to the HL7 Foundry, you can find fast security. You can actually download the entire reference implementation in a Docker script, not Docket, Docker script, and build it yourself. This will give you a full view of the code, how it was written, all the basics aspects of it. If you just want to test against it, it's available for testing 24/7, 365. We have a number of people test it all the time, and we're actually building it out, working with the Foundry group at HL7 to make this part of the entire infrastructure for all of Foundry. So it'll be possible to go into other things like DaVinci reference implementations with a fast security token. So you go into fast security, you do your registration, it will issue your client ID and the token that can be taken and used as part of that. That's still in process. We're very happy, but things move slowly. So as we roll that out, we're hoping to get a
Well, I don't know if Dave just lost his train of thought or if his audio cut out, but that actually sounds great. I'm glad to hear all of that. Thank you.
And I put
did I disappear?
You did disappear, Dave. I put the links in the chat to the Foundry that shows both the security, the Foundry itself, and then we have a bundle with identity and security. So, and then as Dave said, we're still finalizing having fast security be the infrastructure for Foundry, which was we were working on earlier.
Sorry for disappearing mid-sentence.
And then I also put Connectathon track.
That's it, Benji. You're in trouble.
No, I wasn't going to say anything. I also put our individual Connectathon tracks links in the chat as well.
I'd like to rebut that statement by Benji in saying, I don't have a train of thought. I can't even work up a good engine.
Fast answer.
Wait, that's not the rebuttal I thought it was. I'll figure a better one. The questions, or do Benji not just continue our comedy routine?
Any other questions for the FAST team while they're here with us today? What a wonderful presentation. Thank you both for coming and sharing all the new stuff that's going on with FAST. We still have a few minutes left. If you have a question, you can drop it in the chat. You can come off of mute. Now's your chance.
If you don't have a question, you can simply say how wonderful you think fast security is and how great a presentation this was, and say how many beer you'd like to buy me at the next time I see you.
Well, thank you both so much. I think I'm going to stop the recording now. If that's okay.
Thank you, Casey, for the opportunity. FAST is very appreciative.